So, today in this episode, we are talking about vascular disease and its health, like what it is, why it matters, and the signs you should never ignore. In this podcast, we have a very special guest that is Dr. Robbie K. George, who is Chief of Vascular and Endovascular Surgery at Narayana Health City, Bangalore. So, welcome to the new episode of Talk with Doc, sir.
Thank you so much, Akash. Thank you for having me here. I'm very grateful for you guys for doing this.
So, sir, can you give a brief introduction of yourself to the viewers?
Okay. So I am a vascular surgeon. So I started my original training on undergraduation in medicine in Delhi. So after that, I did my postgraduate training as a master's in general surgery again in Delhi. Worked there for some years. Then I was a senior lecturer in Chandigarh Medical College for years. And then I did my vascular surgery training in England, where we were for about 8 years. And I was working there as a consultant before I came back to India, and I've been in Narayana now for almost 15 years. So that's kind of been my journey in vascular surgery.
So, how long has it been that you're serving people in this healthcare sector?
So I've been a vascular surgeon for the best part of almost 20 to 25 years now, and been a surgeon for 35 years.
So, vascular becoming a vascular surgeon was your piece of interest?
Yes. So to be honest, when we were in training in general surgery, we got very little exposure to vascular surgery. So I'm talking about the 1990s. It was not a specialty that really existed very much in
Indeed,
India.
yeah.
And we would see a lot of patients with vascular disease who would be untreated or who would have poor outcome because there was no one there who knew what to do. And we very often failed to diagnose it even. So a lot of my exposure to vascular surgery came when I went to England. And over there in the Western world, vascular surgery is a very well developed specialty, and you see what is possible there.
Okay.
And once I went there and I saw the specialty, which has got this very unique spread, which is very attractive to a surgeon, where all you operate, what all you do. That's what kind of got me attracted to vascular surgery. And then from then on, that's what I've been doing. And returning to India, you just realize there is so much need for what we do. So it's been very satisfying coming back and doing all this here.
Okay. So, starting off with a very basic question, what is vascular disease and why should people pay attention to it? And what is vascular surgery?
Great question, Akash. And thank you for asking what is probably something people are not very familiar with. So the word vascular refers to vessels. What are vessels? Vessels are the little tubes which are the road to life. They carry blood all around the body. So your heart pumps it out. How does it get to your brain? How does it get to your legs? How does it get to your kidneys? It's through these small pipes. How does it get back to the heart? Again, it is through small pipes, which is another set of vessels. Vascular surgeons deal with disease of these blood vessels. So if they get blocked, if they become ballooned up like a bubble which can burst, these are the kind of things that we deal with in vascular surgery. So what are the kind of diseases? Essentially two types. Either they get blocked or they get blown up.
Yeah.
If they get blocked, blood does not reach a section where it should reach, which causes all kind of complications. In the heart, it causes a heart attack. In the brain, it causes a stroke. And these are things patients are aware of. Blockages of blood vessels in the legs causes gangrene. People lose legs. Blockage to the kidney causes loss of the kidney and kidney failure. So, variety of ways it can present.
Okay. So, in our whole body, it is made up of these small capillaries and vessels. So, basically, you work on all of it.
Yeah. So, as vascular surgeons, we work on blood vessels in every territory except in the brain and on the heart. So, on the heart, it's typically dealt with by cardiologists and cardiac surgeons. In the brain, it is typically dealt with by neurosurgeons. Every other territory is looked after by vascular surgeons.
I have a very interesting but very small question. So you also see cases like, love bites and hickeys because it is related to capillaries
Yeah.
and also, is there any treatment for that?
Well, actually, I wouldn't know because a lot of our patients are not in the age group where they're getting love bites and hickeys. But yeah, I think
Okay.
you probably got more experience with this
Of
than
course, I
me.
mean, I
But,
get calls often.
okay, sure. I think it's just a matter of using some ice, some painkillers, and making sure it doesn't get worse.
I know this was not in the script, but it just popped in my head.
Sure, sure, sure.
So I've got another quick question. Like, is heart disease and stroke, does that also come in vascular disease?
Yeah, so they are all manifestations of vascular disease. So blockage of a blood vessel anywhere causes damage. So if the blood vessel to the heart gets blocked, you get a heart attack. If the blood vessel to the brain gets blocked, you get a stroke. When you get blockages of blood vessels in other parts of the body, you get a different kind of symptom, which is what we end up dealing with.
Okay. So when it comes to the heart surgery, so you guys don't take it.
No, we don't normally do heart surgeries. We deal with the vessels, which are the tubes that come off from the heart.
So who is most at risk and what habits increases the chance of vascular diseases?
Yeah, that's a good question. So, who is most at risk? There are a variety of risk factors that come in. So, as you get older, your blood vessels get older, which makes you more prone to getting diseases there. Men are more prone than women. So, women, because of the hormone called estrogen, which they have during their years before they achieve menopause, estrogen protects them from getting vascular disease early. People who smoke, people who are diabetic, people who have high blood pressure, those who have a sedentary lifestyle, those who do not have a very healthy diet, all of these factors come into the interplay to what is what resulting in vascular disease eventually.
Okay, so basically you mean having a bad lifestyle can directly cause vascular disease or other diseases.
It's definitely one of the major contributory factors. Like, all of us are born with your genetic code. So your genetic code determines the baseline of where you are. What you do with your genetic code is your choice. Do you choose to smoke, drink, and party, or do you choose to do a very healthy life? Whatever you choose will have an impact on how things eventually turn out. So this combination of two things is what determines your
Okay.
outcomes.
So is there any, like increase in the number of such diseases compared to the last decade or, like previous to that?
Yeah, it's a very good question, and there is. So our lifestyles, the modern day lifestyle is very different from what our grandparents lived. Our grandparents worked hard, ate healthy, frugal meals, walked a lot, smoked. I mean, did not
Did not.
smoke or breathed clean air.
What do you
We,
think has changed in all these years?
everything. So we breathe polluted air, we eat a lot of processed food, we become very sedentary, we don't exercise as much, our lifestyles carry much more stress, we don't sleep as well as we did. I think all of those things add to this epidemic of young people getting early vascular disease, either as a heart attack or a stroke or something else.
Being sleepless at night, can that also lead to any vascular disease?
Absolutely. So you see, the body, we don't give sleep the amount of respect it deserves. This is where the body does its entire repair work and the reset work that it needs. Without sleep, human beings, any animal will die. There is no animal on
Yes.
earth that can succeed, can survive without sleep. So proper sleep where your body resets and repairs is extremely important.
Okay. Among smoking, diabetes, and lack of exercise, which is the biggest concern today?
So I think all three of them together are bad. And all three of them individually are also equally bad. So smoking is the one thing which is a matter of choice for people. You are literally picking up a
Mhm.
cigarette and just putting it in your
Yes.
mouth. Nobody's putting it there for you. So, that's something you should really have control on. Diabetes is to a significant extent determined by your genetics. There are other things that also come in. So you may not entirely have a choice on whether you become a diabetic or not. Sedentary lifestyle, again, is a matter of choice. So you can control two of the factors which you really should. All three of these in combination are something that is best avoided.
And when it comes to exercise and all of that, I've seen people telling that today I have to walk 10K steps. Does walking 10K step can be considered as exercise?
It can. So 10K steps, there's good science on this that shows that having a physically active lifestyle, which includes 10,000 steps a day, is a good target for you to have to maintain the best health that your genes allow you. Now, people always talk about this. That guy never smoked, but he got a heart attack at
Yeah.
45. And that guy smoked his whole life and nothing happened.
Mhm.
That's no credit to the person. That is credit to the genes that their parents gave them. If you have good genes, you will live to 95. If your genes are not so good, even small things will get you early.
Okay. So not just your genetics, but also your sedentary lifestyle and the choices you make can cause you this.
Yeah. So,
That's
we
a
always talk about the two influences in life. There's genetics and environment.
yeah.
Genetics you can't do anything about. Environment, a lot of it is your choice. So pick a healthy lifestyle, pick a healthy diet, stay active. That's what gives you good outcomes.
Okay, so to reduce these, like vascular disease and other diseases happening lately in the environment and like people getting affected by it, do you have any idea to, like rewind it, like Do you have any suggestions for people to, like, not get such diseases by doing some kind of work or anything? Do you have any particular suggestions like that?
Yeah. So one of the most important things if you've been a smoker or tobacco consumer is to cut out the smoking and tobacco. Just stopping smoking within a week, you will start seeing improvements in your health. So tobacco contains a whole mass of toxins. Once you get them out of your system, your body starts healing and repairing. The effects of exercise.
Okay.
So the target we give most people is aim to walk 30 minutes a day, 5 days a week. That's a simple target. But if you can do that, you have clear-cut health benefits to that. The other thing to do is to reduce the amount of processed foods, reduce the amount of carbohydrates that you consume, which unfortunately is very typical of the Indian diet. The Indian diet is full of carbohydrates.
Carbohydrates. Yeah.
So if you're able to cut these things out, especially the processed foods, you reduce the inflammation in your body, which helps your blood vessels and the entire system to actually do and perform better.
What about drinking and passive smoking?
Yeah, I mean, there are neither of these things have any redeeming features. So alcohol has now been shown to be a toxin in
Yeah.
even small doses. Passive smoking is just bad luck. You know, you got somebody who's smoking next to you and you pay the price for it. Just keep away from both things.
Better for a good life.
Yes.
So, are there any warning signs and symptoms before the actual onset of the disease and that people should never ignore?
So that's a great question. And it's not got a simple answer, honestly. So for the heart, if you're getting chest pain when you walk or you're getting, crushing pain and you're sweating, that's a warning sign. When you get a blood vessel disease in the blood vessel to the brain, you get a mini stroke. Now, in the vascular system, one of the commonest areas of the vascular system which gets affected is blood flow to the legs. So the warning sign for that is pain that you get on walking that does not go away till you take rest. So that's the kind of pain which is a good warning sign. If you begin to get small black patches on your feet which are not healing, that's a major warning sign. Left unattended, this can land up with a gangrene, amputation, things which you don't want to happen. For diabetic patients, especially, and I'm sure we'll go through this later on as well, but for diabetic patients, especially, a wound in the feet which is failing to heal is not something to be ignored.
It's a warning sign, a big warning.
Absolutely. Absolutely. It is something which you should get it assessed and evaluated sooner rather than later.
So, this is for a normal person, but what about the ladies, women's wearing high heels, and like, are they very prone to these kind of diseases?
So, fortunately, high heels don't cause blood vessel damage, but they do damage the shape of their feet. And, that can lead to problems for the future and it puts abnormal stresses on your feet. It also makes people prone to getting varicose veins, which is another form of vascular disease, which is fortunately not that dangerous, unlike a lot of the vascular arterial disease, but it can be a real nuisance and can cause a lot of discomfort for people.
So, how are vascular disease typically diagnosed?
So if you go to, I mean, if a patient comes to me, my first thing is I'm going to actually spend some time asking you about your symptoms. Are you getting pain in your legs? What's the trigger for that? Is it because you got a knee that is hurting? Is it because you got a back problem? Is it because of something else? So when we diagnose, a lot of it depends upon the questions we ask you and what pattern of symptoms you're having. So we'll take a history. So one of the things we look for in history is, like I said, if you get pain when you walk a distance and you need to stop walking to get relief of pain. Then we do an examination where you assess the blood circulation in the body, which is done by simple clinical examination. We measure the pulse in the hand, same way we look for pulses in the leg. There are other things we observe to see, do you have signs of what we call insufficiency or inadequacy of blood flow? We will assess to see whether there is any visible abnormalities of your blood circulation. With that, if required, we will combine a variety of scans or tests to visualize your and look at your blood vessels directly.
And are there any diseases that just strikes without a warning or a sign?
Yeah, so there is something that is called aortic aneurysms. And in fact, our first prime minister, Jawaharlal Nehru,
Nehru?
he died of a ruptured aortic aneurysm. Albert Einstein eventually passed away with an aortic aneurysm. And both of these were undiagnosed for a long time. So an aortic aneurysm is a silent killer. It's like a time bomb. It's just the blood vessel begins to balloon out and gets thin-walled, gets larger and larger and larger. And if it suddenly bursts, you'll get no symptom till it bursts, which can then be quite late. So an aortic aneurysm is something that is definitely a silent killer and a time bomb in vascular surgery.
Okay, so people should give some attention if let it be like serious or not, but they should consult a doctor.
Yes, so if you are ever diagnosed to have an aneurysm, you definitely do need to see a doctor to see how it's going to be treated. Does it require treatment? What are the options? Where it is? What are the possible consequences? So it's not something which is to be ignored, certainly.
What does this vascular surgery treatment look like? And is surgery always required, or are there any other options to it?
Yeah. So, while we are vascular surgeons, I don't think we operate on more than 10% of our patients because vascular is a slightly unique specialty in all of medicine. So in medicine, typically you had the medical branch of the specialties and you had the surgical branch. So you had cardiology, which looks after the medical management of the heart, and you have cardiac surgeons who look
Correct,
after
surgeon.
the surgical part of the heart.
And that is where a lot of people get confused. Sometimes when they have to go to surgeon, they'll just go to the consultant. So
Correct.
I suggest, like I tell people from this podcast that, always go to the concerned specialty, not just a general doctor.
That's very good advice. And so you see, so why are we a unique specialty? So if you look at the brain, so you have neurologists who deal with the medical management and you have neurosurgeons. Vascular is the only field in medicine where we look after everything. So we look after the medical management of vascular disease and we also look after the surgical management. And if you require a minimally invasive procedure like an angioplasty or a stent, we do that too. So I think that makes it a unique thing. And it also means that one physician can assess all your treatment options to see what is appropriate for you. So, for a lot of patients with vascular disease, it is medical management. We have to adjust your medicines, we have to adjust your lifestyle, things like that. Some patients will require a minimally invasive procedure like an angioplasty or a stent. Some patients are better off with an open surgery. And that decision is made by the doctor who assesses you, talks to you, and see what is right for you.
Can you explain endovascular procedures in simple terms?
Yeah, so endovascular procedures, I think most patients would have heard of an angioplasty, which is or a stent for the heart. So it's a very simple, well, not simple, but it's a very non-invasive way where through a small injection, either in the leg or the hand, you are able to put a wire and a small pipe which takes you up through this road to life to the point where the disease is. And wherever the disease is, if it's a block, you're able to stretch it open with a small balloon. If required, you place a stent, which is like a small spring inside the blood vessel, which helps to keep it open. And by doing that, you're able to restore circulation. That is essentially what an angioplasty and a stenting is. And not all patients need a stent. Some patients require only an angioplasty. And like I said, not all patients require an angioplasty and a stent. Some just require medicines.
Can you explain about other surgical procedures as
Yeah.
well, like particularly coming to your niche, your department?
Yeah. So the other alternative to an angioplasty and a stenting is a bypass surgery or a repair of an aneurysm. So sometimes if the blood vessel blockage is very long or it's in an area which is not suitable for an angioplasty and a stent, the appropriate thing is to create a bypass. It's like you create a bypass for Bangalore. You put one big long road that bypasses all the traffic.
Yeah.
You don't want to go through the traffic at Silk Board, so you take a bypass. So same way we construct a bypass using either your own blood vessels or an artificial blood vessel, which restores the circulation.
Are you talking about the anastomosis?
It is an anastomosis is the process by which we join the blood vessels together. So we are essentially rerouting blood flow so that it finds an alternative pathway to get to where it needs to. And that's this open surgery bit of it. So not all patients need open surgery, not all patients need an angioplasty and stenting. Different patients require different forms of therapy.
And sir, I have seen so many patients in my practice about the diabetic foot, and it feels like an epidemic. And does it come under vascular disease? And what's your take on it?
A great observation, Dr. Akash. So, India has become the diabetic capital of the world. We have more than 250 million patients who are diabetic. And Indian patients get diabetes nearly 10 years earlier than people in the West do. And from a vascular standpoint, it has a very unique problem. So, when we were in England, we used to operate a lot of white patients. And what you find over there is the white patients have much bigger blood vessels than people in India do.
How is
Now,
it?
why does this is
Yeah.
genetics? Now, why does this matter? The reason it matters is a blockage of a blood circulation is what causes a stroke or a diabetic foot or gangrene. When you have a smaller blood vessel which is narrower, even a small blockage becomes much more significant.
Plague.
Yeah, it's a plaque, what we
Yeah.
call atherosclerosis. Even a small blockage becomes much more significant, which is why Indian patients get heart disease 10 years before those in the West, which is why Indian patients get problems with diabetic foot and all that. Now, why do Indian people or why do people get a diabetic foot? The blood vessels in the leg are especially prone to getting blocked in patients who are diabetics. And when you don't have good enough blood flow going down to a foot, and you are an Indian who walks barefoot, either outside or like traditionally, you will not wear footwear in the house. You have poor blood supply, you're walking barefoot, you get a small wound. That's the start of a problem, which then becomes much bigger.
So what is that factor in diabetes where it makes diabetic people so vulnerable to so many diseases?
Yeah, I'm glad you asked that question. So, diabetes is commonly thought of as a disease of sugar. Now, I will actually want to correct that uh, thought process. Sugar is one of the ways we diagnose and suspect and monitor diabetes. Diabetes is actually a disorder of metabolism.
Mm.
Metabolism is how our body processes energy altogether. So that whole system gets slightly set wrong. And we measure it by measuring your sugars and we track it by using that. But diabetes is a multi system disease.
But people relate directly to sugar, the amount of sugar in your blood vessel.
You're absolutely right. And that is, in a sense, a common misconception. The sugar is one of the manifestations of diabetes, but it also causes diseases in your blood circulation. It causes your blood pressure to go up. It causes people to get blindness. It causes people to lose sensation. It damages your nerves. The underlying problem is high and uncontrolled blood sugars. But there are other factors also that are involved in diabetes. And diabetes, like blood flow disease, affects every system in the body.
Okay.
So it affects your eyes, the small blood vessels in your eyes. It affects the larger blood vessels in your heart, in your legs, in your kidneys. It affects your nerves, which is what tells you that you're having pain or you're having sensation. It affects the bones, how they relate to each other. So it's a multi-system disease, which is why it is so important to control your diabetes and pay attention to it so that it does not manifest itself with disease in multiple places.
So people with diabetes have to be very cautious.
Absolutely. I think it's a disease which is can be unpleasant, but fortunately, with modern treatment, there is a lot that can be done to
And
stop
what
it from
about
becoming
these people
difficult.
using alternate to sugar? They say like I'll drink jaggery tea instead of sugar tea. So
Yeah.
what's your take on it?
So, you see, I'll go back to the question, why did we start using sugar? So, why is cane sugar the default sugar for human beings? Why is it not jaggery? It used to be jaggery in the Indian
Yeah,
culture years ago. There are other sweeteners like fruit-based sweeteners or
monk fruit.
aspartame sweeteners, which have all been used. It's just cane sugar became the most easy way to grow sweet, and that became our default. So artificial sweeteners, there's actually quite good science that shows artificial sweeteners are not bad when not used in excessive quantities, but anything in excess quantities, whether it is sugar or artificial sweeteners, is not going to be good for you.
So it's better to avoid whether it's jaggery or it's a direct sugar.
Better to avoid too much of sugar. It's the biggest driver of inflammation in the body. So too much sugar is just bad.
Isn't that sugar a byproduct of the jaggery?
It is, but jaggery, okay, we get back into a little more of the science. Jaggery is a more complex sugar than the normal white sugar that we have, which is a simple sugar. So simple sugars break down very quickly and cause a very rapid rise in your blood sugar. Well, something like jaggery is a little bit slower. So it's
So-
slightly better. Neither of the two is great, but slightly
But
better.
they both have a same glycemic index.
They do, but I think the trend line is a little bit different. That's what I think
Okay.
anyway.
Okay, so
But I might be completely wrong about it.
you never know. So a lot of people confuse varicose vein and DVT. Can you tell the difference between them and how does the treatment go on and more about it?
Great question, and thanks for bringing it up, Dr. Akash. You're right, it's a very common misconception. So, varicose veins are prominent blood vessels you typically see on the skin surface of your leg. and they affect what is called the superficial, or which is the close to the skin blood vessels of the leg. DVT refers to deep vein thrombosis, which is a blood clotting happening in the deep channels, which are the ones close to your bones in the leg, which are the main big channels. And they both have two very different kind of connotations. Varicose veins can be very mild, very minimally symptomatic, and not really dangerous, while a DVT can actually result in a loss of life. So the reason that happens is when a big blood clot develops in the blood vessel in the leg, the risk is this can break off and go flying off and block the blood circulation to your heart and lungs. And
Also
it can
brain.
cause a catastrophic event which people collapsing and dying. And it is something which has tended to be underdiagnosed for a long time.
Do people get to know when they have a DVT?
So the classic symptom is leg pain and swelling. And that's the classic symptom that people get when they get a DVT. And if you have something of that sort, especially if it has happened quite subtly and if it's affecting only one leg, it should be checked out quickly.
And I see so many people, suffering from this varicose vein. Are there any new procedures that has been invented or, that is being carried out to treat patients in this new age?
Yeah, so varicose veins are a problem for human beings because we stand on two legs. No other animal on earth gets varicose veins. That's an interesting side point. But yeah, so varicose vein surgery during my days of training used to be big cuts in the legs, a
Yeah.
lot of bleeding, big bandage. You're in hospital for 5 days. It was quite unpleasant. Today, minimally invasive is the way. Small injection. Through that, we can do a laser. We can do what's called radiofrequency ablation. We can do glue. Multiple ways of treating varicose veins. You're back on your feet the same day,
Okay.
and it does not require a prolonged
What
rest
what
recovery.
happens in this laser surgery?
So, in varicose veins, if we go back to the basics, what is happening is blood which should be flowing from your feet to your heart is allowed and channeled to go up that way because you have a series of valves which allows it to flow only in one direction. So when these valves malfunction, the blood pools up in your leg or starts flowing in reverse. So when we do varicose vein surgery, we are blocking the route through which this blood is flowing back so that now the blood can flow in the correct route. And this is essentially a procedure through which the destroyed channel or the damaged channel is closed off.
And the calf muscles are called like the second heart in the body, where they help in pumping the blood
Yeah.
to the heart. So you think people who exercise and have good calf muscles, can they avoid, I mean, like disease like varicose vein and DVT are avoidable for them?
Yeah, I think that's probably quite true. If you are uh, active, your blood circulation actually works a lot better. Being active encourages your body to open up new blood vessels, which keeps you healthier. As a second heart, it's especially relevant for older people who become much more sedentary. So just getting them to move their ankle up and down and do a little bit of walking, that 10,000 steps a day that we were talking about, or the 30 minutes a day of walking, really improves your health and your blood circulation all around, prevents a lot of complications.
What age group people are affected from this? And also, I've seen people wearing stockings. Does that really help?
So age group wise, first we'll start with gender. So about 70% of patients who have varicose veins will be women. And the commonest reason for that is because during pregnancy, the effect of having a baby in the abdomen causes pressure on the veins, which then makes them get varicose veins. The other reason is hormones that are associated in women also make them prone to getting varicose veins.
And this also intrigues me to ask you, like in during pregnancy, there is this conditions like files and other hemorrhagic things happening. Does it come under vascular thing?
Yeah. So typically, as vascular surgeons, we don't treat piles, even though piles are actually also dilated,
Exactly.
they are varicose veins of the anal region. But it's something we typically don't treat. But the treatment is again similar. It involves laser, it involves removing the varicose veins. So surgically, the treatment's honestly not that different. And typically, like you raised the question in pregnancy, people get this. Pregnancy, a lot of patients get varicose veins. And I would very rarely suggest any invasive treatment to a lady who's pregnant. Typically, once your pregnancy is over and all is okay, then we'll see what you got left behind and intervene based on that.
Okay, so what about the stockings?
So, stockings are a very simple, low risk, mechanical way of countering the symptoms of varicose veins. So, stockings do not cure varicose veins, they control them.
Okay.
So, If you have minor varicose veins or you have varicose veins which you don't want to get operated, which are not too bad, stockings are not a bad option,
Okay.
provided they're used in
Uh,
the right way, in the right patient, at the right size. And those things can go wrong.
okay. That's an easy way to, like tackle this thing a bit.
To control it. So, if you're 25 or 30 and you have varicose veins that are bothering you, stockings will keep them under control, but you're not going to want to wear stocking for the next 50 years of your life.
Right, absolutely.
If you're 75 and you have varicose veins and you're not very well, stockings are not a bad way to keep things under control. So that's where the clinical judgment comes in as a doctor, like what's appropriate for my patient.
In your life, have you come across any complicated case, such case that has still stayed with you?
Akash, you see, working in Narayana, you get so
So
many
many
complicated
cases.
cases, and uh, you know, when you got gray hair like me, you have a ton of patients who stay with you, and that's the nice part about being a doctor. And you'll know this that uh, somebody you worked really hard to save, when they come walking back in your clinic, it is such a joy. So for me, remember we had a very unusual situation. There's a 2-month-old baby who came with an aortic aneurysm. So normally aortic aneurysms happen in your 60s, 70s, 80s. And this little girl came with a ruptured aortic aneurysm, which means it had bled.
Okay, so that's how you diagnosed it.
So she came with, her parents just took her somewhere that she's not well, and they did a scan and they said she's got a aneurysm here, which is bizarre and unusual. And then they ended up sending her to us as an emergency. And it's such a challenge. We don't operate on children whose blood vessels are 4 millimeters big.
Oh my
We
God.
operate on adults. But we had to think out of the box, innovatively do different stuff to actually get her through. And now this girl comes back into my clinic, 1 year old bouncing around in your lap. You know, that's just
It's
the
very
joy of
sad to know.
medicine.
Yeah.
That's what makes you so happy. And vascular surgery is about saving lives and saving limbs.
Was it challenging, like handling such a small baby?
It was tough. So, it's uh, operating on such a small child where even 10 ml of blood loss is a very
It's
big
very
thing.
big thing. Very
And having to find the right kind of way to reconstruct things for them, it's all a challenge. And, working in a hospital like this where you've got every kind of specialist available is what allows you to get that kind of a
So I'm sure you
result.
guys had a lot of prep for that. And how long did it take?
So this took about 7 hours of operating.
Oh my God.
Uh, and it was us, the anesthetists who were involved with dealing with very small children, the pediatric surgeons, then the pediatric kidney specialists, then the pediatric ICU specialists. So it's teamwork. So we could never do what we do without a whole lot of people there.
That's a very unconventional way
Yeah,
for surgery,
yeah,
which you don't
yeah,
see usually.
yeah.
And
So I mean, you see, so that's one of the things about vascular surgery. If it is major vascular surgery, it requires good teams and good support in the hospital where you work in to get your patients through these what can be major procedures.
that's great, sir. So I think that stayed with you still. And I think you're
Absolutely.
happy that, like you got to treat that patient and, I'm sure
Uh,
like she's well right now.
she is, and she's one turned into one delightful little girl. And we don't see very many young patients in a vascular practice. It's more of a older patient's disease. So when you have a little girl walking in, it's a breath of fresh air in the
Do they
clinic.
come back with a thank you note and
Oh
again?
yes, yes. So so there is a patient who's named his daughter after me, his son after me.
Oh,
Uh,
really?
you patients will come with tea from Assam. Somebody will come with
Oh,
guavas from somewhere. So this is the joy of medicine. Akash, it's it, making a
that
difference to
is what,
somebody's life.
yeah, a doctor dreams about,
Yeah, yeah,
seeing others happy.
true.
And so I think we are at the last stage of this podcast. So I just want to ask you one last question. What is that one message you want to give it to the people or the viewers that are watching right now?
Yeah, I think it's what we've been talking about. So we don't want you to come to us as a patient. We would much rather you stayed healthy and don't require our care. So how do you stay healthy? How do you keep out of vascular disease? Don't drink, don't smoke, exercise regularly, eat healthy. If you do have a problem, see the appropriate specialist, get evaluated, follow the advice that is there. That's the best chance you have to stay out of trouble.
Okay, that's a great message to the viewers. And if I have to tell for you guys to take up one thing from this podcast, that is never ignore early signs, be it a small or a big sign or symptom. Never ignore it. Always consult your nearest doctor or the concerned physician. And yeah, it was great hosting you today, sir.
Thank
And
you so much, Akash.
thank you for being a part of Talk with Doc.
Thank
And
you.
so this is it for today. And I hope you got to learn more about vascular disease and this specialty. And whoever the students watching this, I think you also can take up this specialty. I mean, it has so much more in the coming future. So that's it for today. Thank you for watching. And till next episode, take care. Bye bye.